again, and welcome to another edition of Get to Know. I'm Scott Levin in the studio, and we have a special guest today, one of the top 10 Buffalo Business First Power 250 members, I believe number 4 this year, the president and CEO, Mark Sullivan of Catholic Health Systems. Mark, thanks for joining us today. We appreciate your time, sir.
Well, thank you for having me, Scott. It's a pleasure to be here.
All right, first of all, your reactions when you found out that you were in the top 10 of Buffalo Business First Power 250. I know you were number 249 a few years ago. Now you're number 4. Tell me your reaction.
It really didn't change much. I'm reminded at home what number I am, and at work I have a great team. It's all about the team. So I think for the organization it's great because, you know, whenever someone in an organization is recognized, it really elevates the whole team. It elevates the 10,000 workers we have at Catholic Health. But, you know, higher power for me, I go by a higher power than whatever lists the paper. But it was quite the honor, to, quite frankly, to be even on the list.
Well, it's great to have your time today. People do want to get to know you a little bit better. Talk about your home for a little bit. You grew up, you're a Western New Yorker. Tell me where you grew up and where you went to school.
Yeah, so, you know, we only have a couple minutes I know today, but basically I'm a 5th generation Buffalonian. In fact, my great-grandfather came to Buffalo in 1854 and started the first homeopathic hospital, which eventually became Gates. So my family has been here for a long time, all different paths, but I grew up in Orchard Park, New York, and then my family raised my family out in Eden on a farm for about 25 years. Really great experience for my daughters and my wife, and super fortunate to marry a sweetheart that I met when I was 11. I told my mom someday I'll marry her, and sure enough, when I was legal, I went and asked her to attend a function with me for Jack Kemp, and we really hit it off. So it was pretty spectacular.
That is amazing. So you live out in the country, and are your children living at home with you? Are they grown up, married, and where did you go to college? I believe Canisius, if I'm right.
Yeah, so all those in one question. So my daughters are grown. We moved. One daughter is in Buffalo still. She's late 20s, and my other daughter is in her mid 20s. She actually lived in Liverpool, England for a while. Both are engaged. One is engaged to a gentleman in Liverpool, England, so she travels back and forth, and the other is engaged to someone locally here in Buffalo. So we're fortunate to have them local and visiting all the time.
That is amazing. Congratulations to that. And tell me about your college experience and what you majored in.
Great. So, you know, I always say this to the young people I talk to, you never know what your path is going to be, right, Scott? So for me, I started out at Gannon University, I was political science and criminal justice major. And one day I was on a payphone calling my dad, and Dr. Bratton from Chautauqua Institution walked by me and said, you know, you got a minute before the conference starts? I hear you're from Buffalo. Would you want to work on the U.S.-Soviet conference we're having this summer? This was 87. You know, no sweat. I'd love to do that as a political science major. So was at Gannon for 2 years and then transferred to Canisius. And during that time was really spectacular because I got an opportunity to work with Dr. Bratton at Chautauqua, traveled to the Soviet Union during the Cold War.
Wow.
Did some work for Jack Kemp in Washington, and then settled down at Canisius and realized I got to finish my degree. So I had a great experience at Canisius, went there for undergrad. And then during my graduate school days, I was fortunate enough to get an internship at Sisters in 1992. And been there ever since. I pulled from my wallet my intern ID card from 1993.
You're kidding. You still have your intern ID card?
Yeah, to remind me to treat all interns and everyone that wants a shot at a career the right way. And so enjoyed Canisius, learned a lot. A great, you know, Jesuit institution. Learned a lot at Gannon as well, and excited to be here. So right out of my internship at Sisters, started in home care. And have never really looked back, and been with Catholic Health 27 years.
Now, Catholic Health, I believe, you've been with them since the inception. 20 years ago is when it all began for Catholic Health. How has that grown into this billion-dollar business so quickly?
It's amazing. You know, sometimes you look back at history, Scott, to kind of realize who we are at Catholic Health. So I've been with Catholic Health 27 years, so I was with Catholic Health before it came together. But ironically, just like when we were founded over 170 years ago. Sister Ursula Mattingly came to Buffalo and during the cholera outbreak, and raised $5,000 and bought a school and opened Sisters Hospital, which was the first hospital in Buffalo. And so Catholic Health has a long tradition of serving those in need. And it came together in a very interesting way. There were competing hospitals within the region. They were focused on the ministry of the Catholic Church and wanting to support the poor and those underserved and those in need. And came together in '98 and really started to build a network of hope, a network of high quality, work together with the physician partners we have, community leaders, and and really have grown into the health system we are today. And I'm fortunate to have incredible CEOs before me, with Joe McDonald, who was here for 15 years, a great mentor, and really made some courageous decisions to advance our health system. And I'm hoping to continue to do that as I move into my fourth year in this job.
Now, so many people have trouble, they live paycheck to paycheck, making ends meet, and healthcare is one of the largest expenses for everyone. Where do you see things going in the future for Catholic Health and the growth?
Right. So I think, if we take healthcare aside for a second, being the leader of a billion-dollar organization with 10,000 associates is not just about delivering healthcare. It's about improving health. So one of the things that I have a difficult time putting my head on the pillow on is that there's so much healthcare in Western New York, but there's so much disparity. We saw that with COVID. We see that with inequities in the Black and brown community. So we need to do a better job of being out in the community as healthcare providers, all of us in Western New York, all of my friends and colleagues across town here, and really get after trying to improve the health of the community. We have a lot of healthcare in Western New York, but the healthcare disparities and where we fall as far as disease prevalence is pretty high on the chart. So what Catholic Health is focused on, and just last year was a crazy year with COVID, but what kind of slipped on the radar is we made a $139 million investment in Epic, the single largest, highest rated electronic medical record in the world. And we implemented that November 1st. So that meant everything is on one record. Scott, if you traveled overseas, you traveled down south, you would be able to have access to your record. Anyone would be able to do that. And what's important about that is we believe that we want to meet the patients, the community, where they want to be cared for, whether it's on your couch, whether it's through an app on your phone, whether it's coming face-to-face with your physician. So we're looking to adapt healthcare to meet the community's needs moving forward, not just in 6 months, but for years to come. And that's led to our investments in non-bricks and mortar and more investments in technology, which allows us to be more nimble as things change with healthcare.
So important what you just mentioned, and what's really come to light during this year with the pandemic. I know we've done a lot of stories on it recently also. You talked about the Black and brown communities and the vaccine. We're finding that a lot of folks in the Black and brown communities don't necessarily have a primary care physician or end up going to the doctor for a lot of this, a lot of their scans and blood work and checks. So they don't have that support system. Do you see that might change in the near future also?
Absolutely. I think, the silver lining with COVID is it really was a magnification of these disparities I've mentioned a couple times.
Absolutely, right.
So a great example is we have MCCC, Mercy Comprehensive Care Center, which is down on Louisiana and South Park. And we did with AstraZeneca support, we did a healthy heart program. It was amazing. 3 generations came in. And we were teaching them how to read labels. We were teaching people how to take care of themselves, how to identify issues with health and eating and nutrition. And working closely with Feed More of Western New York and Tara Ellis has been a great experience for us because it's about nutrition, food, shelter, education. So we're focusing on that. And then I think the last thing we know, health drives the economy, of course, people's health in those communities you mentioned. But we also, 2 years ago, were awarded a grant from the Ralph C. Wilson Foundation, Junior Foundation, $15 million to bring training to underserved communities in healthcare and how to manage budgets and how to manage your family. And we have a lot of graduates coming out of that program, and they'll be in the workforce. So, it's difficult. We want to be there for the community. I think the more we can reach out and help and listen. I think the one thing we have to be careful of, Scott, is not going into communities and saying, this is what you need to do.
Right.
We need to respect their legacy. We need to respect where they've come from, learn about their background, learn about their history, and then meet them in the middle and figure out how we can help in any way, whether it's
so
food,
true, boy. So true, Mark. You get it. You're exactly right. You need to meet them in the middle, and you need to listen also. That's excellent advice. I just want to get back to you for one moment. You were thinking about criminal justice also. I think you retired from a reserve sheriff. Am I correct? Tell me about that part of your life.
Yeah. So where do I begin? So my father was in the Air Force for 38 years, a remarkable man, remarkable mentor to me. Had an opportunity to be in law enforcement, the FBI, and back in the day, that was where I was headed. I had an internship for Jack Kemp in Washington and worked on his presidential campaign, all before the age of 20, quite honestly, and then realized that, I wanted to do more. So I worked on my criminal justice degree. In the middle of that, we were caring for my grandfather at home with hospice, and I started to see how healthcare impacted his life and our family's life, and got an interest in healthcare. So during my master's degree program, I took a parallel track with criminal justice and healthcare. Sounds kind of odd, but I really fell in love with it. And after my internship, I really wanted to get into healthcare. And after 9/11, staying close to my father on everything he did during the Cold War with the Air Force, I wanted to do something in the community. So I was able to join an incredible unit. It's called the Erie County Sheriff's Scientific Staff, a reserve division. And I joined that about 15 years ago. It's a detail that is at the disposal of the sheriff in a reserve capacity, fully sworn deputy, to be there for different things. And I brought expertise in healthcare. So it was founded in the 70s where the sheriff could bring in experts from different fields that may not be law enforcement, but could give advice on things like I could do Medicare fraud, I could talk about home care, I could talk about healthcare, and be there for multiple sheriffs over the years, going back to the very beginning. And it was great. And after 9/11, they actually swore us in as deputies that were, armed and went through training at ECC North. And when I took on the new job here, I felt I couldn't give it 100% of my time, but have a great brotherhood. I still stay in contact with them, and was honored to do my little part with the Erie County Sheriff's Reserve Division.
That is great. And you serve on a few boards. I believe the Buffalo Zoo also, right? You're still active on a lot of boards?
Yeah, not the Buffalo Zoo anymore. I definitely enjoyed my time on that. I resigned from that board, I think, a year ago. When we ended up getting into COVID, and our COVID response has been 7 days a week. And as you know, we started the first and only COVID-only hospital in the nation about a year ago today. I really wanted to focus on my faith, my family, and my work. And I don't like doing things 50%. Right. So I had a great conversation with Nora at the board and just said, listen, I can support in any way I can, but I can't physically support that board anymore. So not as involved as I was in the past.
Mark, a couple more questions. The name of your company, Catholic Health, how does faith play a role in your everyday work when you go to work? How does faith play a role for you?
Well, the good thing for me, Scott, and I hope this is true for anyone, it's not in my work, it's who I am. Mm-hmm. So I hit the jackpot 27 years ago. I work for an organization that my beliefs, my values, my faith is with me 24/7. So it's an honor. It's not a job, it's a vocation. So I'm so fortunate to be leading a ministry of the church. And I don't say that in any type of hierarchical way. I just say that we believe in our mission to reveal the healing love of Jesus to all. We welcome all faiths. Mm-hmm. It's inspirational. When you go on a floor when you're in a COVID hospital and you have death around you, and you see the care that these nurses and aides and physical therapists are going in and holding the hand of someone and asking a family member, do you want to pray with them? It's just, it's the energy you need. And during an uncertain time last year is really, really when the light came through. And I go back to Sister Ursula, which we started the call with about 170 years ago during cholera. No MBAs, no Zoom, nothing. Our faith drives us at Catholic Health, and that really is a magnet to people that work for us. It doesn't matter what your faith is. Mm-hmm. It just matters that you always want to do what's right by the person you're serving. And it's a remarkable place to work, and it's an honor to work with the 10,000 associates and the over 2,000 physicians and the community. And I'm really proud of the people I work for and all the caregivers at Catholic Health. They're just remarkable people.
Amen. Very well said. And I'll be honest with you, my wife had some cancer surgery 3 years ago. That was at Sisters Hospital, and I will never, ever forget it. It was one of the all-time best experiences. Imagine that. You go in for cancer surgery, and we were like, what an amazing hospital. The people, the facilities, the cleanliness. It was incredible. We tell everybody about what a great, great service we got at Sisters Hospital here in downtown Buffalo. Last question. What do you love most about Buffalo, Mark?
Oh, geez, everything. I love the people. The people are amazing. I love the Buffalo Bills. We've had season tickets. My dad was in the top 19 that waited in line to buy them. We still have the same seats. I love the people, the community. I like the underdog feeling. I wear Bills stuff everywhere, Sabres stuff everywhere, where I am in the world. And I'm just proud of the community. And I think that Buffalo is probably one of the most amazing communities in the country to raise a family, to trust your neighbors, to have great elected officials that support the ministries that we're working on the organizations. And it's a secret in a way. It's a gem for those that live here. And no matter where I go, I see someone from Buffalo. And it's pretty remarkable. And I love being here, and I love the winters, the summers, the seasons. It's a great place to live. And,
Buffalo and Catholic Health are lucky to have you here in Western New York, Mark. Thank you so much for joining us for Get to Know today. We got to know you a little bit better, and congratulations once again on being in the top 10 of Buffalo Business First Power 250. That's quite an honor, sir.
Great. Thank you so much for nice being with you, Scott, and all the best to you, and God bless you and all the work you do. So have a great day.
God bless you too. Thank you, Mark.